You're listening to Misunderstanding Dementia Podcast. This episode is brought to you by Misunderstanding Dementia Course, and you can put in 50 to get a 50% discount on the course. Thank you.
Hello everyone, this is Dr. Mike Chua, physical therapist, certified dementia practitioner, and host for today of our Misunderstanding Dementia Podcast. Today we've got a very special guest. Her name is Erika Graham. She's actually a full-time caregiver for her mother right now that has an early onset dementia. She used to be actually an awesome truck driver. She competed with a lot of different competition, and she was actually awarded the truck driver of the year in a certain competition. So again, let's go ahead and welcome Miss Erika Graham. Erika, welcome to our show.
Good morning, Mike. How are you?
Oh, I'm doing good. It's a great Saturday morning. How about there in Nashville? Everything doing good there?
Oh, it's beautiful. Nana woke up in a good mood. It's a good day today.
Oh, wow. Well, thank you very much for joining our show. So, is there anything else that we need to know about you, aside from that introduction, family-wise, and stuff like that?
I'm very fortunate. We do have a lot of family in the area, and I've got a great support system. I moved my mom in with me about a year ago, and, we're finding great success. A lot of it's from the information you've provided so far. I stopped truck driving full time. I was over the road. I would be out on the road anywhere from 6 to 8 weeks at a time.
Oh, wow.
And now, I'm full-time at home. I just stopped driving my truck when we found out that we had my mom in assisted living. And they told us she needed a higher level of care, and I just wasn't comfortable. I'm not knocking assisted living. I'm saying I just wasn't comfortable with that for my mom. And I was fortunate enough to be in a position to say, I'm going to stop driving my truck and take care of my mom as best as I can and see if I can do this. And that's where we're at today.
Oh, wow. Well, just for the benefit of our listeners, earlier, before we started the show, Erika and I were talking about her doing her truck driving and right now being a full-time caregiver for her mother. And I mentioned earlier, before we started the show, is that there's always a time for career and there's always a time for caregiving. And right now she chose to be a caregiver, which is really good. And if you're listening right now and you've given up your career and you're taking care of your loved ones right now, don't be discouraged, because your career will always be there. The work will always be there, but your family member, your loved ones will not always be there. So, let's learn from Erika right now. She's making the most out of it, and it's just good. If I was given the chance to go back in time, speaking of going back in time, I'm wearing a shirt called Back to the Future shirt. I bought it at Old Navy. And speaking of going back in time, if I was given the chance to go back in time, I would go back in time and be with my mother and my father right now. So I think you're doing a good job, Erika. And if you're listening, if you're taking care of your loved one full time, you're doing a good job. So enough of that, Erika. I'm sorry. It's all about you today.
Thank you.
So,
it's always all about me and Nana.
Well, next question would be, how did you end up being a caregiver?
I ended up being a caregiver coming from a visitation off the road. I'd been out on the road, and my mom had been in and out of the hospital all year long, like 12 weeks in the hospital and about 3 more months in the rehab centers.
Oh, wow.
To get discharged back. And, every time she gets hospitalized, she never, ever gets back to where she was before. It's very disorientating and scary for her not to be in a routine and be surrounded by things that are familiar. So they told us that she had to go into assisted living, and I looked at my sister Kim. We were in the meeting together, and that I was going to try this. And we said either we're going to, succeed and do magnificent things, or we're going to, fail miserably, but we're going to give it a try together as a family. And we have, and it's been really wonderful for my mother. Like I said, she was in the hospital a lot last year. This year she's only been hospitalized 2 nights and 3 days, and that was a misdiagnosed UTI. Other than that, she hasn't been in the hospital one time. Being able to get her up and active and stimulate her, she was walker ridden. She had to use her walker and her wheelchair most of the time. Now, she's up, she's walking around without assistance. She goes swimming, and I know water can be confusing for some people, but her mother was a competitive swimmer when she was young, so she still embraces the pool. It helps so much with her physical therapy, and I feel like that's the important part about her recovery. It's getting up and moving around and having a routine that involves spaces that have been familiar. So it's very important to get as much family around her as possible, because it just helps her to remember who she is, I think.
Oh, wow. Oh, wow. I really like what you said about routine and activity, because routine is very important. Just recently, I reached out to one of a fellow dementia practitioner. Her name is Vicky Fitch, and she has this acronym called GRACE, and one of the letters is R, and she's really harping on that routine aspect, because repetition and routine is very important. So if you guys are listening right now and you've got loved ones that has and you're taking care of, a regular routine is very important. And just like in rehabilitation, rehab, if you break down the word rehab, means repeat, hab means habilitate or life. So if you want to have if you want to regain your life and your strength in your body, you have to keep on repeating a certain routine. So I think you're doing a good job there, Erika. So keep it up. And
thank you.
Yeah.
Thank you.
Right. Well,
I'm pretty proud of my mom's progress so far. So
you know what? It's you, because you're facilitating her progress. If it's just her and you just leave her alone, she's not going to progress or maintain her current level. So you're doing a good job there. So keep it up.
Thank you, Mike.
All right. And next question is, I know this is hard. What is your major struggle right now in taking care of your loved one that has dementia?
My personal struggle is, the sleep issues. She's been wandering quite a bit at night. I recently purchased one of the autistic blankets, the weighted blanket. And that's actually, for 3 nights now in a row, I've gotten to sleep. I have to wake her up to change her, pull up, make sure her bedding's all dry. I do that around midnight, and she's been sleeping for anywhere from, 8 to 11 hours a night.
Oh,
doing
wow.
it this way. So I think I found something that works for my mom. It's just one of the weighted blankets. They're for, security, and it just helps you feel like you've got somebody cuddled up to you. It's nice. So I think the sleep is the biggest challenge, and I was an over-the-road truck driver, so I'm used to a very erratic sleep pattern. But it's touch and go. You just never know. So I think the sleep challenge and being sleep deprived is an issue for me.
You know what? That's so true. And sleep is very important. Rest is very important. So God Himself rested on the 7th day. So it's
who wouldn't?
And a lot of studies right now that a lot of major diseases are contributed secondary to lack of rest. So
I can believe that.
It's very important that we give our loved ones, a good night's sleep. If they don't have it, obviously if they got insomnia and everything and wandering, give them some great activities. So what you're doing right now is really good. You mentioned about physical activity. She's going to swimming and everything like that, and then boom, giving her that weighted blanket, and it's an overall effect there. So that's good.
I'm sorry to be interrupt. Another thing that we do right before bed is, my mom was a trauma surgery nurse, so she's a very clean person.
Oh,
so
wow.
It's very important her body be clean, or else she gets miserable. So we give her a shower right before we put her to bed. And I've been using the guided sleep meditations off of YouTube. We put those on, and it's like she can take journeys, she can go on train rides, and just listen to something it's like bedtime stories for adults. And it's guided meditations that help them to breathe and relax. And I feel like the combination of the shower and the YouTube videos of, guided sleep meditations and that blanket have become a pretty good recipe for my mom.
Oh, wow.
So if you can't get the blanket, I suggest trying the guided sleep meditations and bathing them before they go to bed. Going to sleep clean is always better, you know?
Yeah, that's so true. I can even sleep not showering, so.
Yeah.
Well, before I forget, I'm going to ask my VA to also put a link on those products that you were talking about, the weighted blanket. If you can send that specific video that you use from YouTube, that would be awesome. That way we can put a link on this podcast, and all our listeners can, buy that weighted blanket and also watch that YouTube for their family members. So thank you for sharing that.
Sure.
All right. Next question, Erika. Why do you think caregivers experience burnout? It looks like you're doing it well. It looks like you're enjoying it and making the most out of it. But I'm sure sometimes you'll experience some burnout. So why do you think other caregivers are experiencing burnout, or how do you manage it?
Well, Mike, I feel like it goes back to just the sleep deprivation will cause you to not be as patient or as attentive because your body is starting to try to shut itself down because you need sleep. So I feel like the burnout will come from that. But currently, I'm fortunate enough to have a good support system where I'm not experiencing that yet, but I'm actually only a year into doing this for my mom. You talk to me in 5 more years and I'll have a better answer. But for now, I'm going to kick that back to sleep deprivation will cause burnout faster than anything. And not getting out of the house and feeling the sun on your face.
There you go. That's very important. That vitamin sunlight. That's
really
very important. Well, you mentioned about sleep again, and what do you call this? Self-care. And if you guys are listening again, you have to have a good night rest, good night sleep. You have to take care of yourself. I've been harping this again and again. If you cannot give what you do not have, you cannot give money to your friends or family members if you don't have enough money. You cannot give love to your loved ones if you don't love yourself. You cannot give care if you don't take care of yourself. So if you're a caregiver right now, whether you're a nurse, a therapist, or a person who's taking care of your loved ones, your spouse, or your mother, your father, you have to take care of yourself. So thank you very much for sharing that, Erika. I really appreciate it.
Absolutely. Everybody take a nap.
There you go. I think we have to have a scheduled nap, right?
Right? Hey, that is actually in my schedule after the flu.
You know what? Speaking of that, in the Philippines, I grew up in the Philippines, and we have what you call siesta. We were once colonized by the Spaniards by Spain, and they have this routine called siesta. So just after lunch, you just have to have 30-minute quick nap. Just a quick nap. And I just remember this when I was assigned in a naval hospital in the Philippines. It's called Cavite Naval Hospital during my internship. And we were not really forced, but we were just asked to sleep after lunch for an hour. So what we would do is eat fast. It's a military hospital. We would eat fast, and then after that, we're looking forward to take a nap. So, and after that, we're so refreshed and ready to tackle the next afternoon. So, next patient's in the afternoon. So, it was a good thing. So. Hello, everyone. Sorry we got cut off, but we're back online. It's me again, Dr. Mike, and I'm here with Erika Graham, continuing our special interview for this weekend. So, our next question, Erika, would be, what helped you in this journey, and how are you coping with it?
I guess what helps me in this journey is, for one, the information available to us online. Being able to look up issues, like I've told you from the beginning, your page has been, awesome for information. And, I go on a lot of the other Alzheimer's pages, and I just, read about things. I do a lot of Googling. I'm coping with it because I'm fortunate to have such a good support system. I've got, my sister, my son, my grandkids, his wife, everybody around here to help. So, I guess I'm coping better because I do have family helping,
There you go. You could have not said it better. If you are taking care of your loved ones right now, you need to have a good support system. You need to learn how to reach out to your family members. People
or friends.
Or friends. People will not be able to read your mind. A lot of caregivers are burned out because they're trying to tell their family members, hey, I need help, but they're not verbalizing it.
Right.
The good thing about when my sister is the one who took care of my father, and she always verbalized help. Hey, this is what we need right now. This is how much we need. This is, what's going on with that, etc., etc. And the communication there is very important. And I really appreciated that from my sister, who was living with him during that time. And we were able to coordinate and help out. So if you are a caregiver right now and taking care of your loved ones, you need to reach out to your family. If they're not willing to help, reach out to your friends. If they're not willing to help, reach out to your community. There are churches out there who can help you out. Send you some a little bit of help. Alzheimer's Association, they've got people that will help you out, educate you, and help you and give you other resources. Or any home health companies out there, they have social workers there who can teach you and direct you to the specific need that you're needing. So I just remember this, Erika, when my father had that situation. I mean, we reached out to certain home health companies in California, and they helped him. They helped him out. Brought him food because he was living independently. Brought him food and everything like that, and it was such a good thing. So.
Right. Well, we have in-home health here now at the house where even her doctor will come here to see her. I don't have to take her anymore to the hospitals at all. We have a nurse, a really good, speech therapist. She's been discharged from physical therapy and occupational therapy for a while now because she's doing so well. But if any issues come up, they're available to us. But I still have a nurse and a doctor that come in once a week and check on her.
Oh, wow. See? I mean, if you are listening right now, reach out to different home health companies or to your physician's loved ones. They can send people to your house to help you out and monitor your loved ones. So thank you for...
And if you're having issues getting your loved ones to go to their doctor's appointments, like they can't, not see the doctor if the doctor comes to them. Like a lot of people, my mom would always come up with something like, oh, I don't feel good, I don't want to go to it. And I'm like, no, we can't do that. And finally we found a fit with a great in-home healthcare, system, that now the doctor just comes here and it's so much better. I mean, there's some things that she still has to go for testing for at a hospital, but me not having to take her to her appointments takes a lot of stress off of planning your day. It's hard to get them out and be, it's like a giant adult diaper bag you're bringing. There's a lot of thinking involved, and if you get in-home health, they can just come in and you don't have to stress on that.
That's right. That's right. That's very good. Thank you for bringing that up, because I actually work full-time for a home health company, so that's what I do.
Good.
Yeah.
Very good.
So,
I wish you guys were closer to us. I'd hire you.
Oh, thank you. Thank you. Well, since we're on that topic already, our company's name is called LHC Extended Care, and we're based in Dyersburg here, and it's really a good company. If you guys are listening right now and you're here in West Tennessee or anywhere in a national level, our company's name is LHC Extended Care. So.
Okay. Good to know.
Yeah.
I go with Willowbrook.
Willowbrook. Oh, I heard good things about you from on Willowbrook.
They've been amazing. Mm-hmm. They've been amazing.
Mm-hmm.
So
that's good. That's good.
That's important also to find a good team so that the nurses and doctors are familiar faces also. My mom's a lot more cooperative today with them than she was when we first started this process because she didn't know them.
That's right.
And she wasn't comfortable. And, you have to be careful sometimes with, if my mom, she'll get weirded out. Like, sometimes she insists on a male nurse or a female nurse.
Mm-hmm.
Like, you have to kind of work around, all that. And they were very compliant, and they found the right team to address my mom's issues. And we're all in communication weekly. And, the nurse comes at least once a week, and the doctor comes every other week.
Oh, wow. So, oh, wow. That is so good.
Yeah, like I said, my mom hasn't been hospitalized in a year, which is amazing. She hasn't had to go to a rehab center. She hasn't had to do any of that. She's had a couple issues come up, just a few UTIs, and that's it. In the year, I've been caregiving for her.
Oh, wow.
And I think it's because she's not having it. And truth be told, when we take our loved ones to the hospital, they get germs. They get exposed to things there. I'm like, don't touch anything when we're here, And having the in-home health care, they're not being exposed to all of those extra things.
That is so true. That is the reason why, home health care is
the way to go.
It's the way to go, and that's the trend now.
Mm-hmm.
We try to discharge patients as much as possible, as fast as possible, from the hospital and also from the nursing home.
Right.
And recovery really happens at home. Not at the hospital, not at the nursing home. The real recovery happens at home because they see a very familiar environment, a familiar person, and that is where you recover. So, next question, Erika. What is the one thing that you wish you knew before all of this?
Well, Mike, I feel like it's got to do with I wish I had truly, embraced the facts and understood how awful it was going to be to see my mom go through this and be a part of it. I wasn't quite, I came into it and I knew it was going to be bad, but, it's awful at times and it's brutal, and I didn't quite prepare myself mentally for what I was going to have to help her struggle with. I knew it was going to be a learning curve and a learning process, but I guess I wasn't prepared to really see, the nighttime confusion, the wandering, the sundowning. I wasn't really, I knew about it, but I hadn't really seen it until I came off the road. And so I just wasn't prepared for that. So I wish I had mentally prepared myself for what I was going to have to witness and, be able to process. That's a learning thing every day for me, Seeing my mom deteriorate's awful. It's awful to see anybody you love go through this disease. And she's a warrior. She's the bravest woman I've ever known. She has moments of lucidity where she knows what she's up against. And you just did a video the other day on telling your loved one whether or not they have dementia or Alzheimer's. And, that was really hard. We used to have to call it her diagnosis. She refused to accept she had it. It was just her diagnosis. And now she's at a point where she has, accepted it. And, she'll talk about it during her lucid moments and tell me how scared she is. And, that's awful to see, And so I think I just wasn't mentally prepared for the journey that I was in the path I chose to take. So.
Well, I also felt that thing about from my dad. My mother, she died instantly from a heart attack, but my dad went on a not really very, but slow death, and
right.
Seeing him deteriorate, and she was healthy and alive, but still working, and then boom, all of a sudden, hit my dad, and not even able to stand up, and it was just heartbreaking.
Yeah.
And if you guys are listening right now through this podcast or the show or whatever, there's always a difference between the fact and then the truth. Fact is, yes, our loved ones will going to deteriorate. Fact is, there's no treatment right now for dementia as of this year. Fact is, eventually they will die. But the truth is, God is working behind the scene, and He still has us in the palm of His hand, and that, the test that we are all going through will actually be a testimony for other people. Erika's test right now will be a testimony for other people because she's doing a good job taking care of her loved ones, and she will pass this down to some of her friends and to our listeners. If you are listening, you're experiencing this big test of taking care of your loved ones, don't be discouraged, because this test is a testimony, and you will share that story, and you will be encouraging other people. So
Right. And I agree. And then, and it's really worth it. I mean, it's hard on us, yes, but it's really worth it to just know you have the peace of mind that you made that choice to really, get educated and at least try to take action to help them. That's what's important.
so true. Thank you for sharing that and letting me realize that again,
Absolutely.
Erika. And then last question, Erika. What advice you can give to other caregivers who are going through the same situation you're having right now?
Well, I can only say Google it. There's so much information available out there. If you're struggling with anything, if you're struggling with behaviors, if you're struggling with issues you're feeling, just Google whatever it is you're struggling, and you'll find something out there that can guide you.
All right, so if you're listening right now, Google it, and it will show up, drmikechua.com. So just kidding. Well, well, again,
you have a lot of information available for everyone.
Well, thank you very much, Erika, for being such a supportive person on my show too. So,
absolutely.
All right. Again, is there any parting words or wisdom you want to tell to our listeners?
Nope, I just wanted to thank you for this opportunity, and I hope everybody has an absolutely wonderful day. And, it started out with a smile, and it'll help. So.
Awesome. Well, again, thank you very much, Erika. I really appreciate you, and you have a great day there in Nashville. God bless you.
Thank you, Mike. All right, have a wonderful day. Thank you, everyone.
Thank you, everyone. Bye-bye. And again, you're listening to Misunderstanding Dementia Podcast, and you can, if you're interested, we have this Misunderstanding Dementia Course. You can put in 50, and you get a 50% discount on that course. Again, thank you, and you have a great day. Bye-bye.
You're listening to Misunderstanding Dementia Podcast. This episode is brought to you by Misunderstanding Dementia Course, and you can put in 50 to get a 50% discount on the course. Thank you.